Everyone can answer this directly. What we estimate statewide is that we will lose between 2 and 5% of hospital staff. That actually may be, honestly, a high estimate from what we heard over the weekend, because we heard that there were people who moved to starting their vaccination series, and then surprisingly, I mean, I think this is like great news, but also probably makes the HR people tear their hair out. There's a number of people who were fully vaccinated, and they were fully vaccinated, you know, months and months ago. It just hadn't gotten around to turning in their cards, and so they turned in their cards on, you know, Thursday, Friday, Saturday. So there's some that's I mean, that's the greatest thing, to find out that people actually are vaccinated. But that's they probably were put in the estimate of unvaccinated, but they were vaccinated. So other folks want to share your confidence, kind of how you're feeling about that?
We're pretty confident that at this point, our numbers are pretty stable. We don't think we're going to lose anybody tomorrow.
Yeah, as I mentioned earlier, you know, I think we'll lose less than 1%. Unfortunately, right now, there are about 220 of our staff who are not in compliance. And so unless something changes, such as they start their vaccination today, they will be separated from us tomorrow.
We have a fairly small number that's at risk, just to repeat that again. And my bigger concern that I mentioned earlier in the opening comments was more along the lines of the number of staff that we've already lost year to date for various reasons, and kind of where that puts us going forward. But the change as of today going into tomorrow, we don't think is going to incrementally add a large number to that.
And we expect that we will have some that go on administrative leave, but we're really working hard to really minimize that across our workforce.
When you look at the reports out of New York and California, there are a lot of folks who move from not there's still people who lost their jobs. There are also a substantial number of people who move from leave to starting the vaccine process. So we're hopeful that will be the case as well. There's a question about so Kate, let me know if that answered your question about how many. Your question was, do any of the hospital leaders on the call know how many, if any, people will be dismissed tomorrow? Dr. Carter, do you have any specific numbers of how many folks you think will leave? I guess you're putting folks on leave, right? So you're not terminating.
So I would say the same thing Dr. Khalil said. We've had a fair amount of loss over the course of the year because of early retirements or choosing to move away. But the difference between today and tomorrow really, we don't anticipate a big number between today and tomorrow.
Great, thank you. Are rural hospitals still going to be hardest impacted by the vaccine mandate? Yes. Rural Eastern Washington, especially. Rural Western Washington is actually in better shape. That's not a fully across the board, but you know, communities like Port Townsend, they've got a higher vaccination rate than some of the Eastern Washington communities.
You know,
Dr.
Cassie,
Carter, go ahead.
Oh, Cassie, I was just going to add, you know, I think even though we look at some of the smaller hospitals, rural hospitals that may potentially be individually harder impacted, ultimately though, our state is so interconnected with respect to the healthcare system that any loss impacts all of us. Because if we have a reduction in services in one area or a reduction in beds in an area, it impacts all of us, as we've seen, given the overall capacity constraints. And so that's one of the things that we're really looking at as well. And we have to think about how is this across the state, and almost thinking of us as one system when we look at the impact of this mandate here going forward. Because as others have said, we're all stretched from a staffing standpoint. And so any impact anywhere within our state is going to have at least a ripple effect across the state.
Thank you. Okay, what are the contingency plans for hiring more workers to replace those who are leaving, especially the rural hospitals that are losing a greater percentage? I'll make some comments and invite others to comment as well. Everybody's looking for staff. So whether it's trying to hire new staff or traveler contracts, or there's another question about the federal resources coming into hospitals. There is potentially, there should be some staff resources that are available to hospitals. everyone is looking and trying to fill those places. We will see a curtailing of services. There's no question about that. People are going to cap it, as Dr. Della just described. There's going to be caps on admissions in some rural hospitals. There's going to be closing down some service lines potentially, or having people have to wait longer for elective or non-urgent procedures or for outpatient services. So it's both a goal to hire more staff, but also to figure out how do you reconfigure services in a way that you can cover with the staff that you've got.